Hello, thank you for joining us for this MDA Engaged community webinar on psychosocial support for living with a chronic illness. My name is Nicole Petrowski, and I am the Community Education Specialist at MDA. We're thrilled to have you join us today for this important and educational webinar. The webinar today is part of our larger MDA Engage flagship community event series, which focuses on bringing the neuromuscular disease community together around the education and social opportunities that we have. Be sure to visit the MDA Engage section on mda.org for updates on upcoming virtual education events. We are recording today's event, and we will be posting it to mda.org's website for on-demand viewing to ensure that those who were not able to join us live today can access this important information. Please know that all phone lines have been muted. We will be having a question and answer session at the end of the webinar. Please utilize the Q&A window to type in your questions. If you hover over the bottom of your screen, a tray of webinar icons will appear, and simply click on the Q&A bubble to open that window and enter your question. You don't need to wait until the end of the session. You can send your questions as you see fit to send them in. And then lastly, I will be putting up a survey QR code at the end of the webinar, and I would appreciate if you would take 2 minutes to fill that out at the end. That helps us with viewer comments to make our programming better for the future. And we take all of your comments to heart, so I thank you in advance for taking that time to do that. Now, I would like to introduce our speaker, Mary Holt Paolone. She is a clinical nurse educator and the mental health nurse at the MDA ALS Center of Hope at Temple University in Philadelphia, Pennsylvania. Mary holds a master's degree in counseling psychology and has worked within the fields of neuromuscular and neurodegenerative diseases since 2005, supporting patients and families, facilitating support groups, connecting resources, and educating communities and fellow healthcare providers for improved quality of life. Ms. Holt Paolone has also focused much of her career on the role and study of stress as it relates to health and chronic medical conditions. She has a private coaching practice for individuals and groups specializing in stress management and mindfulness, and develops programs for various companies, school systems, community, and healthcare organizations. Mary's passionate about helping others live more fulfilled lives, and on a personal note, she loves spending time with her family, her rescue dog Happy, as well as exercise, great pizza, the beach, music, nature, and anything inspirational. So, sounds like right up my alley too, Mary. With that, I would like to turn the webinar over to you, and I will stop my screen.
Wonderful. Thank you so much, Nicole, and welcome everyone. I'm just going to share my screen here. All right, so I can't see your amazing faces, but I do want to say that I am thrilled and really honored to be here, and also, just really thrilled that in the midst of this time that we're all living, that yes, we are socially, physically distanced, but we can still kind of socially connect on this platform. So Nicole and MDA, I just really thank you guys for, providing these webinars in this way for people to connect. All right. So yes, I am, my name is Mary Holt Paolone. Thank you for that introduction. And if people can't remember my name, they often say, yes, the, the lady with the spiky hair. So I, have the deep intention just to really help and support and really be a partner with people along this journey. So as you'll see, as we kind of move through some of the slides, I really do consider, all of you to be the experts, those that are living with these conditions to be the experts. And I am, certainly a partner along the journey with you. So hopefully this is helpful, some information, and yeah, just glad you're here. All right, so I see see if we can advance the slides here. All right, so what are we going to be talking about today? Of course, psychosocial support for those living with chronic illnesses. I, have actually given a number of these talks, I have to say, increasingly over the past year with the pandemic, and this idea of, support, mental health support, psychosocial support is really quite a foundational and really, what we would call kind of a hot topic these days for sure. So I'm again, honored to be here. And I just want to say that when Nicole and MDA had asked me to do this, it's really given me an opportunity. Mental health, of course, is my specialization. This kind of psychosocial, which I'm going to use those two terms interchangeably. So what we're going to talk about today is, how the neuromuscular disease can affect quality of life and mental health, where I certainly don't need to tell any of you that for sure, because as I said, you guys are the experts. But really, what I hope to do is really validate and kind of acknowledge, all that can go along, from a kind of psychosocial and mental health perspective of living with a neuromuscular disease. And this is what I have learned, of course, from research, from the families and patients, people that I've worked with over the years. And it's really been quite an honor for me. We're also going to talk about, yes, psychosocial effects on children and adults living with neuromuscular disease. I haven't, kind of split that out. There's not a section on children and a section on adults. So although issues, of course, will vary. So we'll just, address that as we go through the slides. And then we're going to talk about resources, of course. Resources that can potentially help. And this, a few disclaimers here as we begin setting the stage is that, number one, I don't have a neuromuscular disease. So as I said, you all are the experts, nor do I pretend to know or imagine what it is like to actually live with one, right? So I have been working in this field and with this population for quite a number of years and have learned a ton. I also have a chronic condition myself that I, in my young adult, was diagnosed in my young adult years. And it's really caused me to pause and to really make, my mental health a priority because it really is intertwined. So the other disclaimer is that this is not, I'm certainly not going to address everything, right? This is, we're going to a broad view, and every person is so individualized. So I don't want to say that this is, it's not a one-stop shop, of course, with our medical health, with our physical health, with our emotional health and our mental health. So, just take that into consideration that, yes, we're going to go over kind of some broad discussions, and it's not just I also don't want to take away from the individuality of each person. All right, so let's think about the psychosocial first. And just gonna move myself there. Okay, so when we're talking about psychosocial, what exactly does that mean? So the psychosocial approach is really this idea that, we don't live in a bubble, that, our environment and our social interactions also affect us as a total being. The psychosocial approach, looks at individuals in terms of, the whole context of our psychological, meaning our emotional and our cognitive and our thinking and our mental, all of those factors, and also the surrounding social environment in which we live. And all of these interplay and have an effect on our physical and our mental wellness. So it's really kind of this whole picture. And then when we talk about health, and I really love this because I am certainly what you would call more of a holistic practitioner, where I really do view health along these lines, where it really takes into consideration all of these facets. So when I try to work with my clients, my patients, my families, I really try to encompass, assess, and also address all of these areas because they all are so intertwined. And also the spiritual component too, if that is for people, important for people. So it's this complete physical, mental, and social well-being. All right, so then we're also going to, we mentioned quality of life as one of the objectives to discuss. So what is quality of life? And this is very individualized. So when you actually look up quality of life, yes, there's kind of some encompassed definitions. So the degree to which an individual is healthy, comfortable, and able to participate in or enjoy life events. And maybe that encompasses it for you. Maybe it doesn't. So as you can see here too, yes, it's multifaceted, meaning that there's so much that plays into one person's quality of life. The standard of health or comfort and happiness experienced by an individual or group. And I have to say, my work with, those of you that live with neuromuscular diseases, ALS, muscular dystrophy, CMT, all sorts of things, that there's huge resiliency and positive perspectives that I have just been incredibly amazed and inspired by. That quality of life for some people actually doesn't have much to do with their physical capabilities. So I have been I've learned a ton. So talking about quality of life, we're just looking at, what does that mean for you? So then what is mental health? And again, it's this kind of whole picture, the emotional, right? Our emotional feelings, our psychological, meaning the way that we think, our mental thinking, our cognitive states and abilities, our cognitive processing, and also the social well-being. Of course, our mental health, and I'm going to use this interchangeably with psychosocial. So psychosocial health is kind of that whole picture, and also our mental health, how it affects, it definitely affects how we feel, how we think, how we act. It helps to determine how we handle stress, which is, of course, another one of my passions and specializations. It determines how we relate with others, how we make choices in our lives, and it's really important all throughout. So oftentimes the mental health can kind of fall to the back burner as these physical conditions, what we see happening, or what we feel happening or experience happening physically can take precedence, can take kind of the front burner, and our mental health falls to the back burner sometimes. And what my work is, or my kind of mission, I guess, is to help people really intertwine both. That yes, mental health, and I've seen this in my own life, mental health is just as important, if not even more important than my physical, because how it really plays into my physical experiences. So why is it important to take care of our mental health? So our mental health, our psychosocial health, mental health challenges, whatever they may be, they can be anything from, I'll use this as an example. I'm struggling to, I was just working with a man recently that needs a walker now, and he's not able to, his ability to walk is declining. So he needs a walker, and he has fallen several times because it is difficult for him, understandably. He's struggling with being able to accept, he has lots of emotions in terms of loss of independence and things like that, that are interfering in his willingness to kind of accept the use of that walker. Which of course puts safety as an issue. So mental health challenges, it doesn't necessarily mean like mental illness or anything to that degree, but really anywhere along the continuum can really pose barriers to optimum patient care if it's neglected or poorly managed. And of course, there's a ton of research that does show that mental health, decreased mental health really affects us physically in all sorts of ways. These are just some examples in terms of, increased stroke, increased type 2 diabetes, heart disease, all sorts of things. So it's really important, especially for people that have pre-existing conditions, to be aware of and to address our mental health. It can certainly improve our relationship if we, take care of our mental health and our psychosocial health, and it certainly improves quality of life. So neuromuscular diseases in particular, and mental psychosocial health. So as the slides move forward, you're going to see that psychosocial health, just for the efforts of shortening it, becomes PS. So it's going to be mental and PS health. That's what we're talking about. They're kind of encompassed. So what do we know, from the research, basically? So that mental health issues, of course, over the last number of years, which has been exciting to me, because this says that, yes, the healthcare field, us as clinicians, the physicians and centers, are really seeing this as a significant issue for us to address. they're becoming more and more widely recognized among those living with neuromuscular diseases. And there was a survey done in 2018. This is the Neuromuscular Disease, HCP, is Healthcare Provider Survey. And 75%, they reported that about 75% of their patients experience psychological symptoms that are impacting their optimum living. And people with neuromuscular diseases, of course, report that mental health management in their care, they meet it, they report it as an unmet need in care. So that tells us as clinicians that this is a gap that really needs to be addressed in some way, in a better way, let me say. So what kinds of things affect our mental, psychosocial health, those living with neuromuscular diseases? So as I said in the beginning, you all could be more experts at this than I, identifying these. So this is really just a sense to, identify and just to put our mindset around as we continue setting the stage for how then can we deal with this. And when we talk about these, I do often kind of break these down into, when I meet with somebody, say for the first time, there's 4 categories here that I really assess in a way. The medical physical issues and how does all that play into it, right? So the specifics of each person's diagnosis, how that plays out for that person individually, how it may play out as a nurse, having some awareness of that going forward. The ongoing chronicity of conditions, and this can vary. The rapidity of a progressive, how fast a condition progresses, how long somebody has been living with it. The emotional experiences for, say, let's say, somebody that is diagnosed with ALS later in life, or later in life is, very different than somebody that's diagnosed with ALS, which is amyotrophic lateral sclerosis or Lou Gehrig's disease, in their 40s. So that experience is very different when people are diagnosed. Somebody that has lived with something ever since they were young, the children, I see a resiliency and kind of a sense of, this is almost a sense of normalcy, if I can even use that word, where they've been adapting for so long already. So there's all these nuances to take into consideration. Like I said previously, this does not encompass everything. These are just some ideas. Symptom management around the medical and physical issues, the various symptoms that go along with each of the specific condition that you're living with. And then, care needs along the continuum. What does that look like? Access to care, things like that. That's a little more of the psychosocial, but how to get those needs met. And then, and then the psychology, right? So there's the medical, physical issues, and then there's the psychology in terms of the emotional impact and experiences that people are having. Coping. How do people cope? How are people coping? Self-image. This kind of, some people can have what we call, burden syndrome, motivation, lack of motivation, apathy, and how all this plays into. And then our thoughts. And I'll tell you, the reason that is in capitals for a reason, because, and I'll actually have a slide to that a bit later, but that is a huge piece of our psychology. So I always like to assess, somebody's typical thinking, and not to say that anything is wrong or right. And I really look at all these things in terms of how is it serving me? Is what I typically do does that serve me well? Do I need to change it from time to time? So these are kind of check-ins and assessments that need to happen over time as well, ongoing, to reevaluate. And then the psychosocial issues, which is, broken down here, but this really all encompasses everything. So all these things in terms of, finances, access to care, dependency, socialization, intimacy, relationships, quality of life in the bigger piece, sense of purpose. I find that a huge piece of people's quality of life in terms of their sense of purpose. What they are, do they feel like they're still valuable? And how are they valuable in the world, in their small little world as well? So getting needs met, basic things, socialization. There are tons of studies that show that people that are more connected, live longer. or of course more happy, things like that. And this has really been quite a time for isolation and things. And I will speak specifically to that. So, and then the other piece is cognition, which of course is included in psychology, but really for neuromuscular diseases, what I find, and lots of clinicians find, we need to address that separately as well. We need to assess that separately. So cognition, the way that we think, there are several neuromuscular conditions where the frontal lobe can be affected, and that can, affect the way that we process things, the way that we get from A to B, the way that we problem solve, all sorts of things. Our emotional regulation, our ability to control our laughing or our crying. So cognition is a really important piece that we need to address and assess separately for every person, depending on the diagnosis, for sure. All right. So, okay, what affects the mental health? So I just wanted to give, I would be totally remiss if we're living here in 2020 and 2021, and I didn't mention COVID pandemic affecting people's psychosocial and mental health. So yes, this is straight from the CDC, and the list could go on, actually. Increased reports of mental health challenges, absolutely 100%. And definitely something that I've seen as well, fear about one's own health, access to health, and also, loved ones. And if a loved one gets sick, not being able to be there or how to support, and all sorts of things. Isolation, decreased access. It's just, all over. The ripple effect has been huge for this. And I know that I don't have to speak to it in a sense, but I just really want to acknowledge that this is a really tough time. This is just a really tough time. Worsening of chronic health conditions, increase in ineffective coping strategies. And ineffective, not, again, there's no judgment that's not right or wrong. It's how people are just trying to deal with this really the best way that they can. And that's what I hope to help people see is this helping me, or is this possibly making things worse? And we'll talk about ways to manage, COVID specific, pandemic specific. So what are some of the obstacles? And as I had said, this certainly, yes, I think as a society, right, stigmas is the first thing. And lack of awareness, stigmas, hopefully some things have changed over the years in terms of the stigmas around addressing our mental health, or seeing things that take care of our mental health and our psychosocial health as, woo-woo or new agey or whatever. Hopefully those things are slowly, fading, the stigmas around, but I am aware that yes, there's still a huge stigma to even reach out and ask for help. So that is a challenge. It's a challenge for people to say, yes, I'm having a hard time. That's why as a clinician, I find it very important that I try to meet people with a non-judgmental, and just kind of an open approach that, this is just part of us. This is a really tough thing. And there's no expectations here, so that people feel like they can, and really ask the directed questions, to really leave an open space where people feel like they can, share what they need to share, and maybe ask for help or say, yes, I am struggling a bit, or a lot. And then physical issues, like I'd said before, physical issues can certainly take the front burner. That was definitely, and has been at many times, the case in my own life. And it can also be easier. It can be easier, and this is not in a condescending or demeaning way, but it absolutely can be easier to focus on physical needs versus emotional, mental needs. If I write a list, I have all these things to do to take care of these physical issues, then it's like a checkoff list. Yes, yes, yes. When I'm trying to deal with my emotional, mental needs, it's not so cut and dry. I can't see. When I go and wash the bathroom, I can see that it's clean and shiny. That's helpful. Sometimes I can't see that it's, if I'm dealing with my emotional, mental needs, that we are now all clean and shiny, which is rarely the case. So family history, of course, and I say how we were raised, again, not in a negative connotation, but, just generationally, in my household, we didn't really talk about emotions so much. I mean, it wasn't really at the forefront. It wasn't common conversation. So yeah, I mean, definitely family history can play into, why it is not a priority or why it's not something we think about. Lack of education and awareness. And that's something that I really, is part of my mission as well. Just educating people, letting people know that it's okay to talk about these things, that absolutely 100%, our psychosocial health and mental health absolutely affects our physical health. I never even knew that the two were so connected. And that is absolutely the case. So lack of motivation and apathy, I find that in a lot of people, and that really needs some really kind of comprehensive assessment in terms of what is happening, why is there such apathy, what's going on with the motivation, to find out if it's something kind of organically, physically or physiologically in the body that we need to address. And then there can certainly be lack of resources or access to resources. So that's another area that needs to be addressed and assessed. Just checking our time. So then this comes to, as we start to move into, laying out the issue, right? What affects it? We've talked about what our psychosocial health is about. And then, talking about what possibly stands in the way of us addressing or taking care of our mental health or our psychosocial health. Then, just coming to ourselves and kind of taking some ownership. Then what do I do, right? So now granted, so taking inventory, that's really, awareness is the first thing. I have to check in with myself, checking in with ourselves. And I want to say that some of these questions here, these are just questions that I often ask many of my clients and the people that I work with. And in addition to all of these are kind of mood related. These are mood related, like mental health related. So in addition to these, I'm asking about those other areas. What is your level of care need? What is your access to care, medical care? What's your support system like? All these things, tell me about your lifestyle. How's your sleep? How's your nutrition? How's your, eating? All sorts of things. What do you have any hobbies? How do you cope? All sorts of questions I'm asking in terms of assessment, right? And these are things that we can do for ourselves. So some of you may, maybe all of you already do this. It is, often the human condition that we don't check in with ourselves very often. So checking in with myself and saying, how am I doing today? Definitely becoming aware, what is my thinking like? Am I typically thinking about the negatives or fear-based or things like that? And how are these things serving us? So before we move on to, we're going to talk a little bit about caring for our mental health. But before we do that, I do want to just really acknowledge as well, thinking about how living with a chronic illness, a chronic condition, or, specifically a neuromuscular disease, affects a human being, from childhood into adult life, all sorts of things. I mean, the issues that I encounter with, my families, school related, being able to assimilate in terms of socializing, being able to stay connected. I already talked about access to care and things, and access to other things, which has been really limited during this time. Thinking about intimacy, relationally, financial issues, school, career, housing. The list can just go on and on and on. So that is, first and foremost, before we talk about us caring for our mental health or psychosocial health, I hope, and I congratulate everyone that's on this Zoom call today or this webinar, because it shows already that you're seeking information, you're out there, you're advocating for yourself in ways that everyone is connected to in some way, that you have a medical team or a support team where you feel like a clinical team, whether it is a an individual doctor, primary care physician, or a neurologist or a neuromuscular specialist, or whether, or if you have a whole kind of care team that, like an multidisciplinary team that I work with, that you feel like your team is there for you, right? And that you have the resources that you need. And we're going to talk about some of those to be able to address all of these areas to get support and help. So the care teams, the medical care teams, are so important. So I hope that everyone is connected to somewhat of a multidisciplinary network in some way. And I also realize that that is not a model that is yet supported by insurance companies. So I know that is a challenge. All right, so just moving on, talking about now caring for our mental health. Make mental health and psychosocial health a priority. If it's not, right? If you're in danger, absolutely 100% trumps everything. If you feel like at any point in time, you or your loved one are in danger of hurting themselves or someone else, then absolutely. I put hotlines there. I wasn't going to put a lot of numbers because 911, everybody knows 911. 911 can get you to a hotline if they need to do that, but absolutely 100% reach out. And then, of course, learning ways to identify, acknowledge, and release negative emotions, right? Identification, identify, check in. That is primary. We have to be aware. I have to be able to know where my train is on the track to get a sense of where I'm going, right? Learning how to identify and control negative thinking. So these things are a lot related to kind of mood, modification, and our thinking. Identify stressors. Stress highly affects, and I'm sure all of you could tell me that as well, that stress is absolutely can affect our physical symptoms and the physical experiences that people have. Explore what can be done to, manage stress in a more productive way. Learning coping skills, and if coping skills are limited, then just seeking resources. And hopefully your team, that's why I brought up the clinical team, could be a helpful resource in terms of being able to help you seek these out. Or maybe there's even a social worker on the team that could help with these, or a mental health person like myself. And then seeking outside support, of course, if you need that, right? Like I said, professional, non-professional, and it could be via the social worker, it could be via your physician, making a referral, a friend, a pastoral care person. It could be all sorts of things, therapists like myself. And then there's, kind of more specific ideas here. And again, this is not all exhaustive. It doesn't include everything, right? And the other thing that I want to say is there's a lot of stuff here. So maybe pick one or two, maybe pick one that seems to resonate, right? Do we have to do all of these? If you did, super great. And, I put movement, exercise, and these aren't listed in any kind of priority category, but movement, exercise, range of motion, yoga, anything, which of course can be modified in all various ways. Exercise and movement increase dopamine, serotonin, norepinephrine, all of our positive, which are really our mood stabilizing chemicals in neurochemicals in the brain, in the body. They exercise increases all of those. So there are tremendous benefits. Even if we are unable to physically do a movement and just visualize ourselves doing that movement, PET scans and MRIs actually show that these same neurochemicals are released in the brain and the body. So that is hugely wonderful. There's a lot of people that say to me, oh, I can't do that because of course their ability to move in various ways is limited. Yet the mind can be incredibly powerful. Getting outside safely, of course, excuse me, definitely during this time, right? Safely, wearing a mask, being socially distant or physically distanced. It's interesting. Physically distanced, yeah, we can be socially connected. Connecting with nature in some ways, that can be incredibly helpful for people. Journaling, writing, dictating. I work with several people that can't write, so they use like dragon speech. doing more of what you enjoy, finding out what you enjoy, increasing those positive neurochemicals again. And, you know, one of the foundational things that I talk about with people is, you know, are we hitting the basics? How are the fundamental areas of, are we getting hydrated enough? Believe it or not, our brain floats and it needs water to be able to do that. It needs to kind of float in our head to be optimal performance. So hydration for the whole body is so incredibly important. Are we hydrating? What's our food like? Which can incredibly impact our mood, our sense of motivation, our energy, our fatigue. What are we eating? When are we eating? How's the sleep? All these kind of basic things. Sometimes when I just help people get, you know, shift their food a little bit, get better hydrated, and you know, we get their sleep as best we can back on some sort of, you know, stabilized schedule as best we can, makes a huge difference for people. Consciously, you know, bringing in these practices of gratitude, all sorts of things, learning breathing exercises, relaxation. For a lot of people with neuromuscular diseases, my experience has been, and you could probably tell me this too, that, you know, sometimes breathing exercises are not really the best, or not so helpful sometimes for people, especially people that have difficulty breathing or areas around, or difficulty with those areas, respiratory. So there's other ways to relax, right? Increasing joy, fun, laughter, meditation, mindfulness, therapy, counseling, medications. When I say that, you know, all sorts of, there's a whole range. Not that I'm a medication pusher, but there are really helpful times to talk to physicians and bring those modalities in. So then talking about just being mindful of the time, yes, talking about, you know, how do we care for ourselves? Granted, we've been doing this now almost close to a full year. Yes, during this time. So of course, and these are, I'm probably reiterating things that maybe all of us or most of you have heard already, right? Following the CDC guidelines as best we can, keeping ourselves and others safe, right? Educating with credible resources. So educating ourselves and making sure that the information that I'm receiving or hearing, you know, I know that it's coming from a credible resource. There's a lot of stuff out there, as we all know. So knowing what to do if you start to feel ill, right? And limiting, you know, this has been really helpful. I have to say, even for myself, limiting our exposure to, you know, the intense and controversial at times media. Talk to trusted people about your concerns, and definitely, you know, I hope that your physician or your care team is part of that. And then connecting. 100% connecting wherever, you know, and however possible, virtually this way, which has been wonderful. Getting creative, you know, that's why I really commend MDA. I commend all of you for accessing this platform, even though we can't be physically together. And then, you know, definitely using resources or seeking out resources such as social workers and things to be able to, and other organizations like Muscular Dystrophy Association, of course, that can help with ideas in terms of, you know, if transportation is an issue, care needs, access to care, and things like that. Okay, so one of the things that they had asked me to go over or to just address were online resources for psychosocial support. And there's a plethora, a ton. So again, this is not all inclusive. These are just some that have been quite helpful that I refer to often and that I often refer to other people. If you know of any others, please feel free to put them in the chat that I have not said here. These are not everything that I use, but they're just some, you know, for general mental health information, and also just information around just living with your chronic illness, of course, and specific to mental health as well, and psychosocial support. The CDC, the Center for Disease Control, of course, yes. And they have a whole section on mental health. The Muscular Dystrophy Association. Yes, and you know, the National Institute, the next one, National Institute of Mental Health. That is a governmental organization. So is the next one. It is the Substance Abuse and Mental Health Services Association. That is a governmental national organization as well. Stress.org is really great. helpful, has, stress management options. My website too. I mean, and you can connect with me. I absolutely would forever be a resource to people. If you have questions, if you need some help or some guidance in any sense, just feel free to reach out to me anytime. And I also, during this time of the pandemic, it was just evident to me that people were needing to be connected in some way, and that staying, the mental health piece and the isolation and all sorts of things going along with this was very difficult. So I did start a support group. It's a support meeting. It's a monthly support meeting for those with neuromuscular diseases. And it happens, there's kind of a specific one for ALS. So this one is kind of for general neuromuscular diseases, muscular dystrophy, CMT. There's some mitochondrial, people with mitochondria on there. It happens every Tuesday at 6 o'clock in the evening, Eastern time, not knowing where people are from here, but you can certainly email me if you want some information. Of course, it doesn't cost anything. And we just have a speaker for a little bit on a certain topic, sometimes, not every time. It's just a great place for people to share resources and connect. So just know that that's there as well. Other resources, there's a ton, as I said. So I just want to say that this picture down here, that picture down in the right-hand corner is Matthew Sanford. Now, I want you to know that he does not have a neuromuscular disease, which I apologize for. And I also use him just because of the way that he's been able to transform his experience. So he is one that was living as we would say normally abled. Up until 13, he was in a traumatic car accident, and then he was paralyzed. And he really has, over his years of living with this loss and grief, and also lost a few people in that accident. He's actually a yoga teacher now. And there he's, of course, doing a yoga teacher training, but he also he has a nonprofit organization called Mind Body Solutions. And it is for people that live with disabilities. And I use that word lightly. So what I mean by that is people that, of course, he uses the word disabilities, and I know that that word is used a lot. That, of all capabilities. So he has really found a way to be in his body in quite a inspiring way, and has been able to build a new relationship with his body, and to really use it as, and use his work, and his experiences as a way to help others. So yes, the other thing is YouTube. I'm sure many of you have use YouTube, but if you don't use YouTube, just know that is a plethora of free stuff. So adapted kids yoga is something that I refer to often. Yes, and there's also, of course, tons of videos for adults as well. But I do like that, specifically for the kids, just because it is a way to, the teacher there on the videos, she really engages them in a really positive way, and it's fun. And then the first organization that's listed there, the NICPAD. So that, I'm sure some people are aware of as well, is a great resource for physical ability, and disabilities. And it really can be a great resource. So there's a ton here. There's a great article, for people with muscular dystrophy about, doing yoga. And yes, movement is wonderful, movement. So yoga is just not about that. It is also about, it brings in the relationship that we have with our life experiences. And then, online coloring, video games can be wonderful for people to connect. Music, shows, all sorts of things. Yes. Okay. So, and the other things I just want to say, there's a ton more, right? There's books, there's CDs, there's all sorts of things. There's lots of free stuff. So the power of thought, I just want to mention this. I love Pooh Bear's little, his classic think, 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 think. Yes. So if I can just pause and say, Mary, think, think, think. How's my thinking affected me? This is incredibly huge. And I just want to let, people may already know this, of course. So negative thoughts, the brain, negative thoughts, yes, of course. Negative thinking fear-based, worrying, catastrophizing. There's all sorts of habit ways of thinking that many of us have. Increases negative emotions, of course, and it also increases the release of negative neurochemicals. The body tenses up, it gets ready to fight. It feels like it's in fight, flight, or freeze mode. This happens instantaneously in the brain because it's there to protect us in some way. Now, that can absolutely affect then our physical experiences, right? How we feel, physically. Our body can get all tense. Now, the interesting thing is that positive thoughts have the opposite effect. Oxytocin, which is a natural pain reliever, gets released. Norepinephrine, dopamine increases, serotonin increases. These are all kind of the happy drugs, right? And what that does, there's like relaxation happens in the body often. So that can be really, really helpful, especially if we're living with already a chronic condition. And that we have a choice in this. And here's the interesting piece, that the brain does not know the difference between a real saber-toothed tiger and a traffic jam, right? The brain doesn't know the difference. We have to tell the brain that. So much of our experiences rests on how we're relating to what's happening, whether it's how I'm relating to my diagnosis, how I'm relating to the experiences and the stressors and the people in my life. That is something that we have control over. So we do have more control than we think. And that is, I have to say, one of the primary places that I do work with people, and that so many people find freedom and, from stress, and more balance and more sense of calm, and decreased overwhelm, and all sorts of good things. So the more that we can increase, pay attention and notice our negative thinking, the more we can possibly shift it to some positive. Not that we're going to be positive Polly's all the time. That's not the goal, or that's not the expectation, but just to become aware, and just to know that we do have some power over that. Okay, so the question is, of course, yes, that I continually have to ask myself as well. Do I want my body to be an environment for illness or for health? I can entertain lots of negative thinking, lots of negativity in the media right now. I can go there and, I can make that choice. And then guess what? That affects me physically. I know that there is a cascade of events. It's connected. Or I can, try to bring in things that are more positive, more joy-filled, more compassionate, more open, whatever it may be. And then I can improve, so it's always, do I want to be health? And that's where I invite all of us, right? I mean, all of this. So I really do, I invite all of us to choose health as best we can, and to make mental health and our psychosocial health a priority. So I just really want to thank you for letting me be here. I do hope in some way this was helpful to people and not offensive in any way. But yes, any questions?
Thank you, Mary.
Yeah.
That was very interesting. I was looking through the chat as you were talking, and a couple people had put in some comments. Someone put in glasshalffull.online, accessible exercise resources as a great. You're aware of that one?
Yeah, wonderful, wonderful.
Another person said that they love getting out of the wheelchair and feeling free in the pool. And I know swimming, I know I used to take our MDA kids to summer camp. I was a camp director for many years before this, and getting the kids in the pool was the best thing. That was like the best day that, they had at the camp, was getting in that water.
Yes, thank you. Yes, aquatherapy. Yes, our physical body floats.
Mm-hmm.
It is wonderful, wonderful, wonderful.
Yeah, I love that one. And this other person chimed in and said they went on a family picnic last weekend at a beautiful park, and the whole family had a good time. And that's it. If you can get to a park and, just kind of contain your little area and the weather's nice.
Yes.
That's a great thing. That's a great thing.
Wonderful.
I have a couple questions here. And I don't know if you'd be able to help this question or not, but I'm going to ask it anyway. My dictation app doesn't work as well as I need it to. Do you have any recommendations on any good dictation apps that folks can use?
Not to be too specific, but yeah, not knowing what app that they're using, many people have success, and even I do with Dragon, but
Okay.
it depends on if you're on your phone and trust me, I don't endorse Dragon. I just know that that has been really helpful for people. And if that's the one that you are having trouble with, then the tech support has been really, really helpful with that as well, in my experience.
Okay. Um, Another one. Now this is kind of interesting. What if your family is not very interested in your health? Children don't want to know about it since they have a 50-50, and I'm not sure what that 50-50 means. Chance of acquiring it. Um, I think that's a very sensitive question, but I
Yeah,
think a lot of people tend to, and I don't know for a fact, but I feel like a lot of people are intimidated when, there's difficult news.
absolutely, especially when genetics are involved, which is, yeah, a common component in neuromuscular diseases. So that is a very real issue. And I'm sorry about that as well to the person that is asking the question. I am sorry
Mhm,
that, yeah, that is your experience right now. And definitely, what I often say to that is, as difficult as it is, and as sad as it is sometimes, um, to accept how any one person is dealing with it, because it might be really scary, of course, for them to
mhm,
even consider. And that might be part, I mean, granted, I don't know the situation in particularly, but the best thing that I think any of us can do is really, take care of ourselves as best we can, and, as best you can to seek out, support. And of course, if you need them for care help, then that's something to definitely discuss with, your physician or your group or your medical team, if it impacts your physical care, of
mhm.
course.
And it very well could. She's saying that they're 30 and 33, so
Oh,
they
yes,
very well could be, part of her caretaker people.
yes. And I do have families that, I have people that have families with similar experiences, and yes, and it is a process for them in terms of being able to accept, that they are dealing with it the way that they're dealing with it. And it is sad when, we want family to show up a certain way and
Mhm.
they're not. And yeah, we can't control people, unfortunately.
Yeah.
Yeah.
Um, okay. We do have a couple more questions. Someone's asking, Mary, what's your favorite meditation?
My favorite meditation.
Mhm.
That is a toughie. No. So, so when I talk about meditation, I do teach meditation actually. And when I talk about meditation, so there's various types of meditation. So I practice mindfulness meditation, and
Okay.
mindfulness meditation is what I teach. Um, Within that realm, there are various meditations. There's a body scan meditation. There's kind of specific meditation. So number one, why do I love mindfulness meditation? I love mindfulness meditation because I have a hard time, much better now, but I have a hard time dealing with current circumstances. Life as it is
Mhm.
sometimes is difficult in my perspective.
I would agree with you. I
So,
think most of us on this call would agree with you.
right, yes. And people say to me, so mindfulness is all about being here in the moment
Mhm.
and working on my relationship with that. Many people say to me, why would I want to be present here if I don't like my here, if I don't like what's going on here? So that is the practice of mindfulness. It's about my relationship with things. It's about my thinking. Within that, I probably have to say that my favorite meditation is sitting and loving kindness, if anybody knows what that is, but
Okay.
that's what they were asking.
We can always Google it.
Yeah.
One of the questions that we got submitted, this person says that their daughters are 10 and 5, and they were recently diagnosed with CMT. They're starting some medical interventions such as leg braces, doctor's visits, and they're starting to hear them say things like, oh, I can't do this activity. I will never be able to. Any advice on how to help them feel positive, capable, and deal with maybe not fitting in or doing exactly what everyone else can do? This person says, what can myself as a parent do to be encouraging and supportive and make sure all of us are taking care of our mental health?
Yes.
That's a lot.
Wow. Yeah, we could have a private session after this. No.
I recommend emailing Mary.
Yeah. The first thing I want to say, and I actually want to say to anybody that's on here, which I actually don't think that I addressed, and it could have been, we could do probably a whole webinar on grief and loss.
Mhm.
I just really want to acknowledge the experience that you're having as a parent, as a mom. Holy Hannah, holding all that. And commend you as well for being on this, and also want to say that it is a fine balance. Not knowing you, of course, there were many questions that I would have, but it is a fine balance, because for your children, your kids are so incredibly resilient. They blow me away. And these things, that they may be saying, there's this balance between, really allowing them, giving them the space to grieve, which might be a lot for you to hold. So giving them the resources as well, if they're open to it, such as, like, if they need a counselor, if one of them is struggling a little bit more than the other, or whatever it may be. But this line between, and this kind of balance between, allowing them the space to grieve, the projection of their life as they knew it or as they envisioned it, and then helping them, to move forward. So sometimes it's, with my parents, I'll say, just hearing that, wow, yeah, I can't imagine what that's like for you to think about that. Because oftentimes as a parent, we can feel like we need to fix it. And that we're supposed to do that as a parent. So there's a whole nother thing that goes on with that. So that's it. So sometimes, in a quick little snippet here, just honoring that, wow, sweetheart, yeah, yeah, what do you think about that? Just giving a space, if you can hold that space yourself. And then, they are amazing that then it's like, okay, then they'll move to something next. Okay, so now we're on to something else, right? So yes, it's that balance between the two, and, encouraging that, that they see others similar to them, encouraging that, there's this idea of can't, is potentially something that will come and go. That's been my experience, is this process of, as changes occur, it's this acceptance. It's another process of grieving, acceptance, as short or as long as it is, but it really is this journey of, it's not like you get the diagnosis and you finally wrap your brain around it and then that's it.
Mhm.
It is this journey of kind of up and down. We're kind of, oh, there's a new change. Now we kind of have to wrap our brain hard around that. So it is this ongoing process. But really, yes, just continuing to acknowledge that yes, yeah, other people that are doing things that are similar to them, that are doing, right? So.
We had someone type in the chat and she said, as a mom of two boys with CMD, I listen, support, validate their feelings, then I help them see the possibilities of their future. They can accomplish things, just do it a little bit differently, and also try to find positive things. And I think that's true. I mean, I'm a mom too, and I hear my kids say, "Oh, this is too hard, or I can't do it." And I just think, there's a couple things going on. One is just being a parent is difficult enough, but then if your child does have a disability, that's a whole other level of, they really, do have a hard time doing things and accepting that.
Yes. Yes.
Yep.
And finding resources for yourself as well.
Mhm.
Important.
Mhm.
Yes. Mhm.
Okay. How important do you think it is to have a tribe that is outside of the neuromuscular disease world?
Is this for the person? Living
This
with
this is a different comment. I'm assuming tribe. She's meaning group of friends,
yeah.
possibly. Or do
So
you,
I'm assuming this is a person living with a neuromuscular disease, and then how important is it to have a tribe outside of the neuromuscular disease world? You know, I think that that's a personal opinion. That's a personal
mhm,
preference. I've seen that it can really, really benefit some people. I also see that people just flourish when they are just around abled, like-minded people.
mhm,
So it really is I don't think that there are many rights or wrongs.
okay.
I try to meet things as, what serves you best? What serves you best? Is there, yeah, for what, yeah.
All right. I am not seeing any more questions come through. If anyone has anything else they want to submit, please do so.
Yeah. And you can always, yeah, if you have other questions, I mean, yes, always, you can always email me or whatnot.
Okay.
Hmm.
All right. Well, thank you very much. Thanks, Mary, for a great presentation.
Well, thank you all for
I
being here.
appreciate it.
Yes. I just recommend y'all. I mean, yes, stay safe. Good luck. Yes. And yeah, if I can ever be of help,
Thank you, Mary. We appreciate it.
absolutely.
Thank you.
Mhm.
I also wanted to take a quick second here and invite those of you who are interested in our mission here at MDA and have a diagnosis that falls under our MDA umbrella. We encourage you to join us. You'll be part of a community of families, researchers, physicians, and advocates who are helping kids and adults live longer and grow stronger. I invite you to go to www.mda.org/join and sign up so you can access our materials and information. And then lastly, I would love to hear your comments about the webinar. If you have a smartphone, open your camera and point it at the QR code on the screen. A web page will pop up with a short survey for today's webinar. And if anyone does have any questions after this, please feel free to email me at mdaengage@mdausa.org. This concludes today's MDA Engage webinar, Psychosocial Support for Living with a Chronic Illness. Thank you very much for attending and have a great rest of your day.